American healthcare system.
Let me thank Bill and Deborah and Hank, not only for the work they do every day to keep us healthy, but for their understanding that if they and all of you are going to do your jobs well, we need to guarantee health care to all people as a right. Now, let's take a look at what in fact is going on in America and what is going on in the world. Embarrassingly, the United States today is the only major country on earth, the only one, that does not guarantee health care to all people as a right. You go to Europe, you go to Scandinavia. I live 50 miles away from Canada. Health care is a right for all people.
Yeah, you're right.
Now, I worked on the Affordable Care Act, and I think it has made some significant improvements. But clearly, it has not gone far enough. Right. How can we be satisfied when 28 million people in this country today have zero health insurance?
Shameful.
How can we be satisfied when even more, and that number is growing every day, are underinsured with high deductibles and high copayments?
Right.
So what does it mean in America if you have no health insurance or if you are underinsured? Here is what it means. It means that when you get sick, you may not go to the doctor or nurse to get the care that you need. And what happens if you don't go and get the medical care that you need? You get sicker. And sometimes you die as a result of that. I have talked to doctors and nurses in Vermont and all over this country. And what they tell me is people walk into their offices much sicker than they should be if they went for medical care when they needed it. So our job is to say that if you're sick, go to the doctor, go to the nurse, get the medical care you need when you need it. Don't wait a year. And sometimes when you walk in, the doctor or nurse will say, it's too late. It's too late. Your situation is terminal. That is inhumane, that is insane, and that is not what should be happening in America. And by the way, the result of that is that some 40,000 people a year die unnecessarily because they're getting the medical care too late because they're underinsured or they have no health insurance.
Right.
40,000 people a year. Now, somebody may say, well, you know, Bernie, you're right, that's terrible, but at least we run a cost-effective healthcare system. You know, if you're not spending a lot of money, you're going to have problems. We are spending far, far more per capita on healthcare than the people of any other nation. In the United Kingdom, where everybody has health care as a right, we are spending almost 3 times as much as they spend in the UK. We spend 50% more than the French spend. Everybody has health care there. And we spend significantly more than we do in Canada, where everybody has health care. Now, on top of the health care crisis, but part of it, is the crisis in the cost of prescription drugs. Okay? Now, you want to talk about crazy, and we can go on in talking about crazy and dysfunctionality in the American healthcare system. Think about this one. 1 out of 5 people who walks into a doctor's office and gets a prescription cannot afford to fill that prescription. Now, how insane is that? You get a diagnosis, and you can't take the medicine that you need in order to treat your illness. All over this country, and I've talked to these seniors in Vermont, elderly people are cutting their prescription drugs in half because they cannot afford the medicine they need. Meanwhile, if we talk about crazy, last year the top 5 drug companies who charge us the highest prices in the world, millions of people in one way or another get their medicine from Canada because the cost of medicine in Canada is substantially lower. That's crazy. But what is equally crazy is last year the top 5 drug companies make $50 billion in profits. Yes. You want to hear crazy? This is just a partial list. I don't want to go on forever. Between Hank McKinnell Jr. was Pfizer's CEO from 2001 to 2006. Pfizer, one of the large drug companies in this country. He received a golden parachute when he left Pfizer, worth an estimated $188 million. Okay? People cannot afford the medicine they need. 5 major drug companies made $50 billion in profits last year, and 10 years ago, a guy who works for Pfizer receives a $188 million golden parachute. Frank Hassan, the CEO of Merck, from 2003 to 2009, received a golden parachute worth an estimated $189 million. Criminal. It is criminal. It really is criminal, because what do we say if somebody dies or gets much sicker than he or she should be because they cannot afford the medicine they need? What do you say about that? It is punishing somebody. It is hurting somebody. I think it is criminal. I think it is criminal, and that's why all of us and all of you are fighting to make sure that every American gets the health care, comprehensive health care, that he or she needs. And by the way, when we do that, we save middle-class families substantial sums of money, because we have the most wasteful, dysfunctional system in the world. There are studies out there, the numbers go up and down, but there are studies out there that if somebody goes into, for example today, a community health center, the cost of that person going in for treatment is 1/10 the price than going in to Bill's emergency room. And yet, how many millions of people now have no other access to health care but going to an emergency room, which is the most expensive primary health care in the country? So we've got a dysfunctional system, and we are going to change that system. That is what the American people want. We are going to take on the private insurance companies. We are going to take on the drug companies. The function of health care in a democratic, civilized society is to provide quality care to all of our people in a cost-effective way, not to make billions of dollars in profits for the drug companies or the insurance companies or golden parachutes of $180 million for some CEO of a drug company. Thank you all very much.
Tough act to follow. Hello, everyone. Good morning. Good morning. My name is Rochelle.
Looks like they quickly cut out of that Bernie Sanders event as soon as he took the stage, but it's perfect timing because Josh Earnest.
Good afternoon, everybody. It's nice to see all of you. To those of you who traveled to Asia, welcome back. Before we get started with questions today, I do have a couple of remarks I'd like to make at the top about the President's travel to Elkhart, Indiana tomorrow. Many of you know that the President is going to return to Elkhart, Indiana tomorrow. Elkhart is, after all, the city that President Obama visited first after assuming the presidency. And during his visit to Elkhart, Indiana, back in 2009, President Obama promised that if we worked together, we could pull that community and this country out of the depths of recession and put ourselves on a better, stronger course. More than 7 years after that visit, and despite near unanimous obstruction from Republicans in Congress, that's exactly what we've done. And I've got a couple of charts here that I think will illustrate that progress. We've cut the unemployment rate in half from a peak of nationwide, we've cut the unemployment rate in half from a peak of 10% during the recession to just 5% today. In Elkhart, as you can see behind me, the unemployment rate quadrupled during the crisis, peaking at 19.6%. Today, that rate is down to right around 4%. At the peak of the housing crisis in 2010, 9.5% of mortgages in Elkhart were late or in the process of foreclosure. Today, that percentage is down to 3.7, lower than pre-crisis levels, and we've seen similar trends all across the country.
You mean Indiana, not Elkhart, right?
I believe that this is a statistic that applies to Elkhart, but we can double check that for you. As it relates to the manufacturing sector, this obviously is something that is critically important to the local economy in Elkhart. Manufacturing employment has rebounded, and domestic auto production has doubled since the crisis. Elkhart's iconic RV industry is leading that trend and is set to break an all-time production record this year. In the United States and Elkhart, high school graduation rates have risen to their highest level on record. In Elkhart, the graduation rate has reached nearly 90%, up from just 75% in 2008. What ties all this together, of course, is the President's work to enact the Recovery Act. And the Recovery Act laid the foundation for many of the trends that we just walked through. With $170 million in critical investments in infrastructure and education in Elkhart alone, alongside additional support for the hardest hit families through expanded unemployment insurance and Medicaid, as well as tax cuts for middle class and for working families.